Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome back to another session of CPT Guideline Mastery with AMCI. So let me know, someone, if you can let me know, how do I sound? Am I audible? Okay, thank you, Miss Mills, for letting me know. So we have Miss Mills joining with us from our side. We have Miss Catherine and Miss Tyree as well. Okay, who else are there with us? I can see Patty. Hi, Imani, Imanium. Hi. Okay, happy Friday. So welcome back. So let me know who all are joining with us today, and if you're tuning in live or catching this recording later, I'm really glad you're here. And today we are going to dive into one of the trickiest areas in the pain management coding. Yes, I'm talking about the nerve blocks, the facet joint injection, and the epidural. So there are not much guidelines in these topics, but today we are going to do some great scenarios, and there are some parenthetical guidelines which you definitely need to know before coding from this section. Okay, so coders, I hope you all are ready, and let's get started. First of all, let me read out the copyright. CPT copyright 2026, American Medical Association, all right reserved. CPC is a registered trademark of AAPC. The AAPC content found within this presentation is a copyright of AAPC. The keyword concept FTR, churn, AMCI FAB 7, AMCI ICD 10, flip tap, and MCG are the trademark of AMCI. The credentials CPCC, RCCOC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credentials CCA, CCS, CCSP, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Okay, so who else are here with me? Hi, Brenda. Hi, welcome. Okay, so coders, before we start today's session, just quick reminder, I would like to request you all to take a moment to fill out the survey form towards end of the session and let us know how you feel about this session, because we, as I said in the previous session, we used to have a great attendance, a great active students in the chat participating all the time, but the feedbacks, the survey forms completion rate is less. Okay, so I hope you all take a little bit time. The best part is it will take less than a minute. So please make sure to fill out that survey forms towards the end of the session and let us know how are you feeling about the session. Only then we will be able to come back with a lot of new classes. All right. Okay, hi Hugh for me. Okay, so as I said in the beginning, we are going to review the nerve blocks, the facet joint, and the epidural injection coding in today's session. All right. So topics which we will be reviewing today can be found under your nervous system chapter. To be specific, you will find them in your, yes, over the extracranial nerves, peripheral nerves, and autonomic nerve system header. And under that, you will have a subsection that is for introduction, injection of anesthetic agent, that is your nerve block, diagnostic or therapeutic. And the code series ranges from 64400 to 64530. And today we will be reviewing those injection procedures on the somatic nerve, paravertebral, spinal nerves, and branches, as well as autonomic nerves. Okay, all right. So before we jump into the coding, let's slow down for a moment and build our foundation. As I mentioned earlier, today we will be going and reviewing those injections on nervous system, especially the nerve block, facet joint, etc. Now, whenever we talk about the injection on the nerves, first thing you should ask yourself is that which part of the nervous system am I dealing with? Because in the CPT coding here, is completely based on these classification. So let's start simple. Now, the human nervous system is broadly divided into two main parts. One is your central nervous system, and the other one is your peripheral nervous system. And the central nervous system, which includes your brain and the spinal cord, it is basically the command center. And the central nervous system receives the information, processes it, and sends the instruction. All right. So today's session, mostly our procedures falls under the peripheral nervous system, which is everything outside the brain and your spinal cord. Now, think of it as a communication network that carries a signal back and forth. Okay. Now, the peripheral system is further divided into two parts. First, we have the somatic nervous system, and this is a system which is responsible for all the voluntary action, things you consciously control, like, let's say, the movement of the muscle, the sensation, the pain, the touch, all of that. And then we have an autonomic nervous system, which is completely different. And this handles the involuntary function, the things like the body automatically do, like the organ function, the gland, the smooth muscles, etc. And within the autonomic nervous system, again, there is two classification, which is sympathetic system, which is your fight and or flight. And then we have the parasympathetic system, which is the rest and digest. Okay, now, why am I spending the time on this? Because today we are going to focus on the injection procedures on the both diagnostic as well as the therapeutic on your somatic nervous system, the paravertebral spines and their branches, which basically is your facet joint nerves, as well as autonomic nerves. And this mainly comes under the peripheral nervous system. Okay, so let's begin. Now that we have understanding about the classification of nervous system, let's move into the first major category, and we are going to start with the injection of anesthetic agents, diagnostic or therapeutic, on the somatic nerves. And this is covered under the CPT code 64400 through 64489. Now, what I've done here is that I've broken down this section into smaller parts, so it becomes much more easier for you to follow and understand. So we will begin with the CPT code 64400 through 64454. So if you have your CPT manual with you, it would be great if you can open it and you can go through these CPT codes. Otherwise, please follow me. Okay. So to begin with, we'll focus on the CPT code 64400 through 64454. And these codes have few guidelines associated with them. Most of these codes have few guidelines. And let me tell you here, it would be very, very helpful if you churn your manual. Okay. Especially if you have churned this section, uh, you will find how easier it will be to reach to the answers once we move on to that part, once we move on to solving the scenarios. Okay, so chun is live is what we say here at AMCI, and we also have a dedicated chun Facebook group. If you are not yet there, you can join in our Facebook chun page. All right. Okay, now let's come back to the topic. So for the injection or destruction of genicular nerves branches, you will use a CPT code 64454 and 64624 respectively. So these genicular nerves are basically a group of nerves around the knee that carry sensation like pain, touch, temperature from the knee to the brain. All right. And then we have code 64400 through 64450 and 64454. These describe the injection of anesthetic agent and or steroid into the nerve plex, nerve, or a nerve branch. Now you might be wondering, what a nerve plex? What do you mean by a nerve plex? Now, nerve plex is basically a network of intersecting nerves. So there will be a lot of nerves over there which will be intersecting. Okay, and Yes. Now here comes the important rule. You report these codes once per nerve or plexus, regardless of how many injections are given. So even if the physician gives multiple injection along the same nerve, you will report only one code, and you will see them in the next slide. So next, let's talk about the image guidance. So for certain codes like 64400 through 64450, the image, sorry, 64400, 64405, 08, 20, 21, 25, 3035, and 449 and 50, the image guidance can be reported separately. But for another set of codes like 64415, 64416, 1745, 46, 47, 48, 51, and 54, the image guidance and the contrast injections are actually bundled into the CPT code itself. So you do not need to code the image guidance separately. Now you don't need to memorize this. You can identify them whether the image guidance is included just by carefully reading the code language. All right, so I will show it to you now. So these are the codes which we were talking about, the codes from 64400 to 64454. And you can see these codes are classified based on the specific nerve into which the injection is administered. So all you have to do is to identify the injection, or sorry, the nerve in which the injection has been given, and pick the CPT code. Okay, so that's all you have to do over here. And coders, don't forget, report once per nerve or plexus regardless of number of injection from this section. Okay, so if you have 3 injection that has been given to the vagus nerve, you won't be reporting 64408 times 3. Instead, you will only report 64408 one time. Okay, because you have to report once per nerve or plexus. All right, so I hope that guideline is clear. And yes, so all these codes are classified based on the nerves, and I'm not going to read out all these nerves. You will also see codes like 64416, 64446, 4849, which is for continuous infusion by the catheter. And also, the one point which I've said in the previous slide, you will identify, or you can know which all CPT codes in which the image guidance are bundled into by looking at the code language. You see now we have 64415, 16, 17, 45, 46, 47, 48, 51, and 54. These were the CPT codes which I've mentioned in the previous slide, in which the image guidance is bundled. And you can see that from the screen, the code language itself states that these include the image guidance. And for the remaining codes, image guidance is not bundled. So you can code image guidance with them if performed. Okay, so are we good so far? Let me know in the chat. So we'll move on to the next slide. Let me know in the chat. Okay, so let's move on to the next set of codes ranging from 64455 to 64484, and these codes cover the injection of anesthetic agent or steroid for the plantar common digital nerves and transforaminal epidural injection. Okay, let me click. Yes, so you can see 64455, that is for your plantar common digital nerve, and the next codes 64479 through 64484, they are for your transforaminal epidural injection. So in the next slide, I will show you the CPT codes, and let's first look into the guidelines initially. Yeah, so now again, for the image guidance, just like we discussed, you don't need to memorize everything here. Your only thing which you have to do is to carefully read the code language, and it will guide you to the correct answer. Okay, and yes, these are the codes which I was talking about. So let's start with 64455, and yes, these are for plantar common digital nerves. And these are the nerves that are located at the sole of the foot. You can see that image in the screen, and they are responsible for supplying sensation to the toes, commonly seen in the condition like Morton's neuroma. And next we have the transforaminal epidural injection codes. So first, let's look at 64479 and 64480. These are for cervical or thoracic level. Okay, transforaminal epidural injection at cervical or thoracic level. And 64479 is for the single level, while 64480 is for each additional levels. And then we have 64483 to 64484, which is used for lumbar or sacral level. Again, you have single level code as well as the additional code. So here your coding depends upon two things: the region and number of levels used or levels injected. And here's an important guideline to remember. The code 64455 through 64480 are reported once per site. So whether the injection or whether a single injection or multiple injections are performed at the same site, you will only code once per site. And talking about the laterality, this is a area where students often get confused or get it wrong. So remember, Coda, this is another important guideline. The code 64479 through 64484, they are unilateral procedure codes, meaning they are reported only for one site by default. Okay, you can see the parenthetical guideline over here, which is mentioned. The code 64479 through 64484 are unilateral procedure codes. And what if the procedure is performed bilaterally? So in that case, you will report 64479 and 64483, which is the primary code with a 50 modifier. And here comes the tricky part. The add-on codes, which is 64480 and 64484, they are billed twice. Okay, or they are coded, reported twice. Remember, coders, do not append a 50 modifier to your add-on code. So you have your parenthetical guideline here saying that do not report 50 modify in conjunction with 64480 and 64484, which is your add-on code. All right, are we good so far? Okay, so let's move on to the next section. Okay, next group of codes, we have 64461, 64462, and 64463, which describe the injection of paravertebral block. And a paravertebral block is when it's a regional anesthesia technique where the local anesthetic or anesthetic agent is injected into the space adjacent to the thoracic vertebra. So you can see in the image how it will be injected. And here the medication is placed next to the spinal nerves as they exit the vertebral column and providing pain relief to specific region. And then we also have code 64466 through 64469, which is for the thoracic facial plane block. All right, so these were the codes which I was talking about. You have 64461 through 64463, which is for paravertebral thoracic paravertebral block thoracic region. So you have code for the single injection site, you have code for the second and additional injection site. Also, you have code for continuous infusion catheter. Then you have 64466 through 64469, that is for thoracic facial plane block. You have unilateral code, you have continuous infusion code, and then you have thoracic plane bilateral code as well as continuous infusion code. Great. Now, chorus, continuing with the facial block, we also have another important group of codes, which is 64473 and 64474. These describe the lower extremity facial plane block. Okay, and the code 64486 through 64489 describe the transverse versus abdominis plane blocks. Otherwise, it is also known as tap block. Okay. All right. Now, if you look at this table, this is basically a complete summary of everything we have just discussed. So you observe carefully, you will find that all these codes are organized based on three key things. What is being injected? Nerve, flex, or branch? How is it reported? Is it reported per nerve, per level, etc.? And whether image guidance is included or separately reported. So for most of the somatic nerve injection, they are reported once per nerve plexus. Okay, so if you have a confusion on whether the image guidance are included, you can come over here and you can see if it is included or not. All right. Okay, and this the that table is available for you, available in your CPT manual as well. Now, before we move on to the next sets of code, I want to give you a brief introduction on the facet joint. I want to talk about this facet joint because next we are going to talk about the facet joint injection. So if you look closer at this image, you can see that the facet joints are smaller joints which is located between the vertebra of the spine, and you have facet joint on both sides of the spine. It's present in your right side as well as in the left side, and each facet joint is supplied by multiple median nerve branch. You can see multiple median nerve branch is supplied to the facet joint over here. Okay, so these are your facet joints. Now, because when a physician performs an injection, they may inject multiple nerves around the same joint. So when coding, you must remember that you won't be coding for number of the nerves injected. Instead, you count the number of the facet joint treated as well as the levels. Okay, so if two or three nerves of the same joint is injected, let's say between L3 and L4, two or three nerves has been injected, it is still considered as one level. Okay, now if the physician treat additional joints, that is when your add-on code comes into play. So if you have additional joints like L4 and L5, then you will first code for the primary code, that is for L3 and L4 injection, and then you code for the second uh, additional level, that would be for L4 and L5. All right, so yeah, so let me show you the codes. Okay, before that, there are few more guidelines, few more very important guidelines you must look into. Okay, so this is about the paravertebral spinal nerves and branches. So the code 64490 through 64495 describe the injection of a diagnostic or therapeutic agent into the facet joint. And when determining the level, count the number of the facet joints injected and not the number of the nerves injected, as just I've mentioned. Also, the image guidance and localization required for the performance of paravertebral facet joint. So definitely the facet joint requires image guidance. And if the image guidance is not used, you will use the CPT codes 20552 and 20553. So mostly the image guidance used for the facet joint injections are a fluoroscopic guidance or a CT guidance. And in case if it's not a fluoroscopic or CT guidance, instead of fluoroscopic or in CT guidance, if the physician use an ultrasound guidance, then you will report the codes from category 3. Okay, that is from 00213T to 00218T. So quick summary, count the facet joints, not the nerves. Fluoroscopic CT guidance are used for these facet joint injection. If no imaging is used, you will code from 20552 to 20553. And if ultrasound is used, you will code for the from the category 3 section, code section. Okay, all right, and these are the facet joint codes. Yes, and you have code 64490 to 64495. First thing you have to identify is a region. So if it is a cervical or thoracic, you will use 64490, 91, and 92. And if it's a lumbar or sacral region, you will use CPT codes 64493, 64494, and 64495. And important thing you will notice here is that all these codes clearly mention that they are with the image guidance. Yes, all these codes are for with image guidance, particularly the fluoroscopy and CT guidance. Okay, now you know what to do when image guidance is not used and how to code when ultrasound guidance is used. Okay, so with that, let's move on to the next one. Yes, so these are a few additional guidelines which you must remember while coding the facet joint injection. When the procedure is performed bilateral at the same level, you will report only one unit for the primary code with 50 modifier. And when the procedure is performed on the left side at one level and right side at different level in the same region, you will report one unit of primary procedure code and one unit of add-on code. And when the procedure is performed bilaterally at one level and unilaterally at different level, report one primary code for each level and append 50 modifier for the bilateral procedure. And if the procedure is performed unilaterally at different level, report one unit of primary procedure and appropriate add-on codes. So don't worry with these guidelines. There is a chart actually which will really help you to code when there are multiple scenarios. Okay, this chart is also available in your CPT manual. So when you see the injections performed at multiple levels or bilaterally, unilaterally, you can go inside this or you can refer this table and you can arrive at the correct answer. Okay. All right. And also, coders, remember in the beginning of your introduction or injection of anesthetic agent header, you will find these guidelines. Okay. Or when you have to use a unilateral, the it gives a series of codes when you have to use a unilateral code with 50 modifier and the add-on code with not you should not report 50 modifier with the add-on code. And I'm talking about the scenarios when bilateral injections were performed. Okay, so don't worry, we are going to do some scenarios on these guidelines and that will really help you to understand. All right, so we are moving on to the final category, that is for autonomic nerves. So again, the codes are classified based on the injection. You have 64505, that is for injection of anesthetic agent into the cephalopalatine ganglion. Then you have 64150 for stellate ganglion, 64157 for superior hypogastric plexus, 64520 for lumbar or thoracic paravertebral sympathetic nerves, as well as 64530 for celiac plexus with or without radiological monitoring. So recognize your nerves and code them accordingly. All right, so that's all from the theoretical part, and it's time for us to do some coding exercise. And this is going to be really fun coding from the injection of or the blocks and paravertebral facet joint injection section. Okay, are you all ready, coders? Grab your manual, and here is your first scenario for the day. I've given the answer, the options over here in the first slide itself so that it will be easy for you. And here's your first question, coders. Of the following answer, which best describe the correct CPT coding for this procedure? Option A 64624, option B 64454 77002, option C 64454 with a 52 modifier, option D 64454. A patient presents to the pain management clinic for diagnostic genicular nerve block. Under fluoroscopic guidance, physician injects an anesthetic agent into the superior lateral, superior medial genicular nerve branch, but is unable to safely access the inferior medial branch of the following answers which best describe the correct CPT coding for this procedure. And I will give you 2.5 minutes to place your answers in the chat. Go ahead, place your best answers. Don't worry if you get it wrong. All all I would say is that have a forensic look into these codes and the guidelines. All right, so your time has already begun. All the best, coders. All right, coders, at this time I can see only a couple of answers in the chat. How about remaining of you, rest of you? Okay, I can see some answers coming in. Okay, I'll give you a couple more seconds to place your answer in. All right, give your best answers. So participation is always good. Okay. All right, so let's go ahead, and it's important. As I said, it doesn't have much guidelines associated with this section, but it's very important to have a forensic eye while coding. Okay, so let's go ahead and let's see the inventory. We have a genicular nerve block with fluoroscopic guidance, and CPT code 64624 is coding for a distraction by neurolytic agent. So did we have a distraction carried out here? I don't think so. It was a diagnostic genicular nerve block, right? This was not a distraction procedure. So option A has to go. Option A is coding for 64624. We are left with three codes that are all our three are same, which is 64454. And option B, okay, 64454 is coding for injection, anesthetic agent, or a steroid, genicular nerve branch, including image guidance when performed. So the code language itself is saying that it includes the image guidance, right? So I said you have to read the code language and you will get that whether the image guidance is included or not. So option B is wrong because that is also coding for an image guidance in addition to the CPT code 64454, right? So option B is wrong. Image guidance is included here. Now between option C and D, that's where I saw a split in the chat. Yes, so I would say it's option C, which is going to be the correct answer. And I do see that one of the students have already explained why. So way to go, great coding and great forensic eyes. So 644 sorry, 64454. If you see the parenthetical guideline just under it, you will find that 64454 requires injecting of all the following genicular nerve branch, and your genicular nerve branches include superior lateral, superior medial, and inferior medial. If all of these three genicular nerve branch are not injected, report 64454 with a modifier 52. And in our scenario, yes, the physician injected anesthetic agent to the superior lateral, superior medial genicular nerve, but was unable to safely access the inferior medial branch, right? So all the three nerve branches were not accessed. So according to our parenthetical guideline, we have to assign a 52 modifier, and that makes option C the correct answer. Okay, how are you all doing, coders? Let me know in the chat. Was that an aha moment? Okay. So good job, and great explanation. And by the way, you can also use a table which I mentioned previously in order to arrive at the correct answer. So if you have went through the table, also you can see that on the 64454, 1 unit of any number of genicular nerve branches with a required minimum of three nerve branches. So if there is no three nerve branch, you have to code for a 52 modifier. And you can see the image guidance is also included in this code. So please feel free to use that table. Now let's move on to the next code. A 60-year-old patient. Okay, I'll read the answers first. Of the following answers, which best describe the CPT code for this procedure? Option A 64493, option 64493, 64494, 64495, 64495, option B 64493 times 4, option C 64493, 64494, 64495, option D 64493, 64494 times 3. A 60-year-old patient presents to the pain clinic with severe chronic lower back pain localized to the lumbar region. After evaluation, physician performs unilateral therapeutic paravertebral facet joint injection targeting the nerves intervening the right L1, L2, L3, L4, L4, L5, and L5, L4, L5 facet joint. The procedure is performed under fluoroscopic guidance, ensuring accurate needle placement at each level. And after following, which best describe the correct CPT code, and your time begins now, coders. All the best. Please go ahead and place your best answers in the chat. All right, that is time. So please go ahead. If you have any answers in the mind, please go ahead and place it in the chat. Okay, so let's review this one. And in the inventory, we have a paravertebral facet joint injection with fluoroscopic guidance given at 4 levels, right? We have injection given at the right L1, L2, right L2, L3, right L3, L4, and right L4, L5. So there are 4 levels in which the paravertebral facet joint injections were given, right? Okay, now let's look into the CPT codes. 64493 is coding for injection, diagnostic or therapeutic agent, paravertebral facet joint at lumbar or sacral single level. Okay, so this looks like a good code. We have 4 level in which injections were given. So 64493 is coding for first level or single or the first level, right? Then we have add-on code 64494, which is coding for the second level. Okay, even that's good. But if you look into the CPT code or the option B, which is coding for 64493 times 4, now that is not possible, right? Because the guidelines specified that you have to use add-on code for second, third, and additional levels. So 64493 is wrong because it is coding for it is, sorry, option B is wrong because it's coding for 64493 times 4. And also I would say option D is incorrect. That's coding for 64493 and 64494 times 3 because we have another code, another add-on code for the third and any additional levels. Okay, that is 64495. So 644, option D 64493 and 64494 times 3 is also incorrect. Now between option A and option C, the difference is that option A is coding for 64495 times 2, right? While option C is coding for 64493, 64494, and 64495. Now, let's count the levels here. We had 4 levels of paravertebral facet joint injection. So 64493 is correct. It's code for the first level. 64494 is also correct. That code for the second level. And 64495 is for third and any additional levels. So I want you all to focus at the code language here. It codes for third and any additional level beyond the third level, right? So for the fourth level, you don't need to code 64495 times 2, right? 64495 is enough in order to code for third and any additional levels beyond the third level. So that makes option A incorrect, and option C is going to be your correct answer. Okay, coders, let me know, how are you all doing? How do you do? I can see only a couple of people place answers. I can see a lot of people are still in the stream. Please go ahead and let us know. How are you all feeling? And let us know if the explanation helped. So meantime, I will move on to the next question. Of the following answers, which best describe the encounter? You have option A 64493 RT, 64494 RT, option B 64493 with a 50 modifier, 64494 with a RT modifier, option C 64490 RT, 64491 RT, option D 64493 RT, 64494 with a 50 modifier. A patient with a diagnosis of lumbar facet joint syndrome presents for pain management. The patient is positioned prone and lumbar region is prepped and draped in a sterile fashion. Using C-arm fluoroscopic guidance, physician identifies the target levels. Local anesthetic air is administered over L4, L5, and L5 S1 facet joints. A 22 gauge needle is advanced into the right L4, L5 facet joint, and correct placement is confirmed in both AP and lateral views. After negative aspiration, a mixture of bupivacaine and triamcinolone is injected. The needle is repositioned to treat L5S1 facet joint bilaterally Under fluoroscopic guidance, placement is again confirmed and the same medication is injected. Patient tolerate the procedure well without complication. Okay, Koda, so your 2.5 minutes have already begun. Go ahead, place your answers in the chat. All right, so I can see only two people answering in the chat. Come on, Goddess. You can do better than that. Go ahead, place your best answers in the chat. Don't worry, don't be shy, don't worry. Give your best answers. Okay, so let me walk you through this in meantime. So first thing first, let's get our inventories out. We have lumbar facet joint injection with fluoroscopic guidance given here. And we have the injection is given at two levels, right? One is at L4, L5, that is right side only, and bilaterally at L5 and S1. So these are the levels which we have in hand. And with that, let's look into the code options. The option C is coding for 64490. That is coding for an injection diagnostic or therapeutic agent paravertebral facet joint, and the level is for cervical thoracic single level. Now we didn't had cervical thoracic facet joint injection in our scenario. We were coding for a lumbar facet joint, and the levels were involved was lumbar and sacral, not thoracic or cervical, and that makes your option C incorrect. So option C is wrong. Okay, yes, option C is wrong. Let's look into the next one. Option A is also wrong. So you know why option A is wrong? Because of the modifiers. Yes, option A is coding for, both codes are for RT modifier. Well, we had a procedure performed on L4 L5 on the right side while at L5 and S1 we had a bilateral procedure. So definitely you cannot have RT modifier on your both codes. So you have to go. I don't need to look into the codes. You have to go. And now remaining is option B and option D. So 64493 is coding for injection, diagnostic or therapeutic paravertebral agents at a lumbar or sacral single level. That's a good code. And 64494 is an add-on code that is used for additional or second level. Okay, so that's also good because we had two levels over here. Now, the difference between option B and option D is in the sequencing order, right? And this is where I would use the table which I referenced in the previous slide, in the beginning slides. Okay, this is where you can use this table. And for the procedures, you can see we had two, so we had one level injected bilaterally and one level injected unilaterally, right? Yes, L4 and L5 was unilateral, and L5 and S1 was bilateral. So it fits this criteria. And the level at which the injection was given is lumbar or sacral. So you go over here and you pick this one. This is for lumbar or sacral. Your code should be 64493, 50, and 64494. So since it's an right side, I just assigned RT modifier, and that makes option D incorrect, and option B is your right answer. All right, so I hope the explanation helped. If not, please to let me know in the chat. Okay, great. So I'm just skipping one scenario here. Okay, so since we are almost time, I will move on to the last scenario. Okay, and yes, here we go. This is the last scenario for the day. Of the following answers, which best describe the encounter? Option A, 64490, 64490, 76942. Option C, 0213T. Option D, 64493. A 47-year-old patient presents with a chronic neck pain suspected to be originating from cervical facet joints. After evaluation, physician performs a diagnostic paravertebral facet joint injection targeting the right C5 to C6 level. To guide the accurate needle placement into the facet joint, physician utilizes ultrasound guidance throughout the procedure. Of the following answers, which best describe the encounter, and you got 2.5 minutes, your time begins now. All right, Coda. So, okay, great answers. Good try. I really appreciate you placing the answers in the chat. Great effort. Okay, good job. All right, so let's start reviewing this scenario. We have in the procedure inventory paravertebral facet joint injection, which is given at C5 and C6 level, right side, and it was done using an ultrasound guidance. Okay, so these are the codes which we have in our hand. 64493, which is option D, is coding for injection, diagnostic or therapeutic paravertebral joint at lumbar or sacral level. Now let me go back and look into the inventory. I can see that we had injection that is given at cervical level, C5 and C6. So C5 and C6 is your cervical level, not your lumbar or sacral level, right? So I think option T is incorrect. Wrong region. Okay, now we are left with three options. 64490 is what present in option A and B. 64490 is coding for injection, diagnostic or therapeutic agent, paravertebral facet, or with the image guidance. And if you carefully look into the brackets over here, and if you remember what I've said in the beginning of the session, they include the image guidance. And the image guidance used here is fluoroscopy or CT. But in our scenario, the image guidance used is ultrasound guidance, not a fluoroscopic or CT guidance. And do you remember, coders, the guidelines? Yes, the guideline states that if an ultrasound guidance is used, you will have to code a report from the category 3 codes that would be 00213T through 00218T. And the correct answer for this scenario would be 00213T, which is for injection, diagnostic or therapeutic agent, paravertebral facet joint with ultrasound guidance, cervical or thoracic single level. Okay, so this is a unilateral procedure, and that makes option C the correct answer. Okay, let me know. Did you had a aha moment? Um, we don't need an RT modifier here specifically, but if you want to indicate the laterality, maybe you can use it, because you can see over here in the parenthetical guideline, these are unilateral codes, right? And for using the bilateral procedure, you have to use 00213T with a 50 modifier. So if you want to indicate the laterality, you can, okay? But for the exam, you will code for the best available out of the four. Okay, and the most accurate code here was option C. All right, so did the explanation help? Let me know in the chat. Did the explanation help? Okay, I can see, I'm just looking into the chat and I see a lot of B, a few C. Okay, I hope the explanation helped and you had an aha moment. Okay. All right, so it's time for our hand pull scenario, or the rapid fire hand pull scenario. We will be reviewing most of the guidelines which we learned today. Okay, so which factor is most important when determining a level for a paravertebral facet joint injection codes ranging from 64490 to 64495? Is it the volume of the anesthetic agent used, or is it the number of the nerves injected, or is it the number of the facet joint injected, or the total number of separate needle inserted? Let me know the answers in the chat, coders. You can type the options. You have option A, B, C, and D, and you have to do it quickly. This is a rapid fire scenario. So place your answers quickly in the chat. What do you think? The facet joint injection codes are guided by which guideline? Okay. All right. Anyone else? Great answer, Raj. Great answer. Yes. The correct answer is option C, the number of the facet joint injected. Great answer, Patty. Excellent job. Okay, Euphemia also. went with option C. Great job. All right, let's move on to the next one. Which of the following is correct approach when reporting a bilateral facet joint injection? Option A, Epen 50 modify to all the codes including the add-on codes. Option B, report all codes once with 50 modifier. Option C, use 50 modifier only on the primary code and report add-on codes twice. Option D, report all the code twice without 50 modifier. What say you coders? Give your best answers. We have reviewed these guidelines. Hi Brenda, I can see you. Great, great answer. Okay, go ahead coders. Place your best answer in the chat. Okay, I can see the chat is getting much more interactive now. Okay, thank you. We can see aha moments in the chat. Awesome. Yes, as Miss Mills just said, aha moments are really, really priceless. Okay, so if you have learned something, that is precious. All right, so give your best answers, coders. We have reviewed these guidelines. Anyone else to please answer? Okay, okay, all right, great, awesome. Yes, the correct answer is going to be option C for the for the bilateral facet joint injection. If you remember, use 50 modifier for the primary codes. You remember that I said like there are a few codes in which these bilateral guidelines apply. So your facet joint injection also falls under those codes. So for the facet joint injection, if it is performed on a bilateral level, for the primary code you will assign 50 modifier, and for the add-on codes you will not assign 50 modifier. Instead, you will report the add-on code twice. Okay, so great job so far. Let's move on to the next one. Which coding approach is correct when you use ultrasound guidance for your facet joint injection? Report 64490 to 64495 with a 76942. Report 64490 to 64495 only. Report 76942 alone. Report code from 0213T to 0218T. What say you coders? You must nail this one. This was from our last scenario, the last one which we did. You got this coders. Okay, okay, I can see one answer. I can see the answer from Raj. Good. Anyone else? There you go. Great answer, Brenda. Okay, I will wait for 5 more seconds. Okay, great. Excellent. Excellent job. Yes. The correct answer is going to be option D. That was from the last scenario which we reviewed, right? So good job. So you have learned from that scenario. Okay, next one. Which of the following coding or which coding approach is correct when facet joints are injected? Injections are performed without image guideline image guidance. Option A 20552 to 20553. Option B 64490 to 64495 with the 52 modifier. Option C 64490 to 64495. Option D 76942. What say you coders? You got this. You got this one as well. All right. Okay. Okay. Good. Good try, Chorus. Good try. So, if you remember, I told you that the the facet joint injections are to be performed with a image guidance, right? And the most common image guidance used is a CT and fluoroscopy. So, if you have a ultrasound guidance, that's when you code from the category 3 codes. And if you don't have an ultrasound guidance, guideline status to code from 00255 sorry 20552 to 20553, and this is where it's mentioned in your CPT guideline. CPT manual. If imaging is, this is on the paravertebral spinal nerves and branches, and you can see if image guidance is not used, report 20552 or 20553. And as I said, if ultrasound guidance is used, that's when you use the category 3 codes. Okay, so I hope this was also a aha moment for you all. All right, so these are the guidelines which we learn. As I said, this is an easy section, but there are some coding nuances, I would say, some small guidelines, hidden guidelines over here and there. And if you churn your manual, you are not going to miss these sections and these guidelines. So coders, let me know, how did you do today? Did the session help you feel more confident with the nervous system coding? But if you think you need more practice guidance, that's fine. Remember, mastery doesn't happen in one session, it happens over the consistent repetition and with the right support. And we are here to support you. Okay, so coders, if you feel you need more practice, uh, or you want to revisit today's concept, head over to our AMCI channel, YouTube channel, and inside the channel you will find a lot of dedicated playlists. Also, you'll find a dedicated playlist for the CPT guideline mastery sessions. This playlist includes all our previous sessions recording where we have broken down the topics step by step in details. So take your time, go back, rewatch, reinforce your understanding, and I truly hope these videos will be helpful for you to strengthen your coding skill and boosting your confidence. Okay, so I would request once again, coders, to you all, please take a moment to fill out that survey form that is shared in the chat. You can also let us know the topics. I've read a lot of survey feedbacks from last session, and I'm considering the topics which you have mentioned as well. So if you have any topics in your mind, go ahead and mention that in the chat so that we can come up with those contents in the upcoming sessions. And your feedback is extremely important for us, because only when you share it with us, we are able to come back with more sessions and videos tailored for your needs. So please take a minute to complete the survey form and let us know your thoughts. That's all we ask. Okay, I will be also pinning the survey link here in the comments. So if you're not watching this live stream, if you're coming and just watching this from a recorded site, please go ahead and please feel free to complete the survey forms. Okay, so don't forget, coders, if you enjoyed this video, smash that like button, subscribe, and share it with someone who need to see this, especially someone who's preparing for your board exams. Okay, so I would like to thank my team. Yes, Chan was the key. Excellent. Yes, you're right. Chan is a savior, especially in these kind of this type of questions. Well, these are not too much guideline based, but there are some guidelines. As I said, these are a bit dry kind of topics. But if you have your manual, Chan, that would be really, really great. Okay, so please don't forget to like the video, and I would like to thank my team, Miss Mills. Thank you, Miss Mills, Miss Brenda. Uh, I think Miss Brenda has joined us. Okay, and Miss Catherine, as well as we have we have Miss Tari as well with us from the instructional team. Okay, thank you, team. Thank you, coders. So please, as I said, please don't forget to fill out that survey form. We'll see you next week with a new topic. Till then, keep coding, stay safe, and happy weekend to all of you. All right. Good night and goodbye.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. AMCI.